Silent, deadly, invisible. These three words perfectly encapsulate blocked arteries, one of the most insidious health threats that millions unknowingly harbor within their bodies. Right now, as you're watching this, your arteries could be slowly constricting, gradually cutting off vital blood flow to your heart, brain, and limbs. In America, someone tragically dies from cardiovascular disease every 36 seconds. Yet, here's the shocking truth. The majority of these deaths could have been averted if individuals had simply recognized the early warning signs. The real tragedy is that your body is constantly transmitting distress signals about arterial blockages, but these crucial warnings often disguise themselves as mundane annoyances that we too readily dismiss or outright ignore. That unusual fatigue you've been experiencing, the slight breathlessness when climbing stairs, or the cramping in your legs during a walk, these aren't merely indications of advancing age. They could very well be your body's desperate attempts to alert you that something is profoundly wrong with your circulatory system. Before we delve into these potentially life saving warning signs, if you're new to our channel, a warm welcome to your journey towards significantly better cardiovascular health. Make sure you hit that subscribe button and ring the notification bell so you never miss our life altering content. Your heart will undoubtedly thank you for it. And please let us know in the comments section which country you're watching from. We genuinely love connecting with our global community of health conscious viewers. Today, we're uncovering 10 critical warning signs that suggest your arteries might be perilously blocked. These aren't just minor inconveniences, they are potentially life threatening symptoms, rigorously backed by extensive research from leading medical institutions such as the Mayo Clinic, Cleveland Clinic, and UT Southwestern Medical Center. What you're about to learn could quite literally be the difference between catching a problem early and facing a severe medical emergency that could tragically end your life. Now, let's systematically walk through these vital warning signs of blocked arteries, commencing with the very first one: chest discomfort or angina. The inaugural warning sign is chest discomfort, medically referred to as angina. However, here's the perilous aspect. This doesn't always present as the dramatic chest clutching pain often depicted in movies. Many individuals describe it more as a pressure, tightness, squeezing, or a persistent aching sensation in the chest. According to research from the Mayo Clinic, this discomfort is quite literally your heart muscle crying out for oxygen when coronary arteries become narrowed due to plaque buildup. The underlying mechanism is both captivating and terrifying. Your heart muscle demands a constant, uninterrupted supply of oxygen rich blood to function optimally. When plaque progressively accumulates within your coronary arteries, it creates a bottleneck, severely restricting blood flow. During periods of increased demand, such as climbing stairs or experiencing significant emotional stress, your heart requires more oxygen, but the narrowed arteries simply cannot deliver it. Furthermore, this pain doesn't always remain confined to your chest. It can radiate outwards, much like electrical signals gone awry, traveling to your arm, particularly the left arm, neck, jaw, back, or even the upper abdomen. This pattern of spread occurs because your heart shares common nerve pathways with these other bodily regions. Angina typically manifests during physical activity when your heart's oxygen demand is heightened, then gradually subsides with rest as that demand decreases. This predictable pattern often deceives people into thinking it's merely fatigue or muscle strain, when in fact it is your heart's urgent and desperate distress call. Each episode of angina signifies your heart struggling to receive adequate blood flow. Research consistently shows that angina is frequently the very first warning sign of significant coronary artery disease, and those who experience it face a substantially elevated risk of experiencing a heart attack. Any recurring chest discomfort that follows an exertion related pattern absolutely warrants immediate medical evaluation. Do not dismiss it as mere stress or indigestion. Your life could quite literally depend on recognizing this critical warning. Next, number two, shortness of breath. Unexplained shortness of breath is far more than just expected breathlessness after intense exercise. It's experiencing a feeling of being winded during activities that previously never bothered you, or even feeling breathless while at complete rest. This symptom is particularly insidious because its development is often gradual, making it all too easy to rationalize away. When arteries become blocked, your heart struggles immensely to pump blood effectively throughout your entire body, leading to a dramatic reduction in its pumping efficiency. Imagine trying to water a garden through a severely kinked hose. No matter how vigorously the pump works, inadequate water ultimately reaches its destination. This means your tissues do not receive optimal oxygen delivery, and your body compensates by forcing you to breathe faster and harder, desperately attempting to extract more oxygen from each breath. Mayo Clinic research indicates that dyspnea, medical term for shortness of breath, is often one of the earliest signs of heart failure, a condition that frequently results from long-term arterial blockages that have progressively damaged the heart muscle. As your heart weakens from constantly laboring against blocked arteries, it becomes less efficient at pumping blood, leading to fluid backup in your lungs. Women, in particular, should pay close attention to this symptom, as research demonstrates that women are more likely than men to experience shortness of breath as their primary heart disease symptom, rather than the classic chest pain typically experienced by men. The progression of this symptom is deeply concerning. It may start with breathlessness during strenuous activities like climbing stairs, advance to feeling winded during flat walking, and eventually occur during normal everyday activities, such as getting dressed or simply having a conversation. This progression directly reflects your heart's declining ability to meet your body's oxygen demands and effectively serves as a countdown to potentially more serious cardiovascular events. Next, number three, dizziness, lightheadedness, or sudden nausea. This unsettling trio of symptoms frequently signals a reduced blood flow to your brain directly caused by arterial blockages. When the arteries responsible for supplying blood to your brain or heart become narrowed, your body struggles to maintain adequate oxygen delivery to these vital organs. Dizziness occurs when your brain doesn't receive a sufficient supply of oxygen rich blood, leading to that disorienting spinning sensation. Research from UT Southwestern Medical Center indicates that these symptoms frequently occur together during cardiac events because they share a common underlying mechanism: reduced cardiac output resulting from blocked coronary arteries. When your heart is unable to pump effectively, it struggles to maintain adequate blood pressure throughout your system. The sudden onset of nausea is particularly significant because your digestive system requires a substantial amount of blood flow to function properly. When your heart's pumping ability is compromised, blood flow is often redirected away from digestive organs to prioritize and maintain flow to more critical areas. Many people erroneously dismiss these symptoms as merely dehydration or stress. However, when they occur in combination, they could strongly indicate serious arterial blockages that demand immediate medical attention. If you experience a sudden onset of dizziness, lightheadedness, and nausea simultaneously, particularly when accompanied by chest discomfort or shortness of breath, this could be a critical indicator of an acute cardiac event. Next, number four, unexplained sweating, fatigue, or cold sweats. Cold sweats are a particularly worrying warning sign. Unlike normal sweating that occurs due to heat or physical exertion, cold sweats emerge when your body is under severe physiological stress, stemming from inadequate blood flow to your vital organs. When arteries are blocked and your heart struggles to pump effectively, your body activates emergency response systems, triggering the release of stress hormones that induce sudden, clammy sweating. Cardiovascular research consistently shows that unexplained fatigue is often one of the earliest signs of heart disease, especially in women. This isn't merely typical tiredness, it's a persistent, overwhelming exhaustion that simply doesn't improve with rest. When arteries are blocked, your heart is forced to work significantly harder to pump blood, eventually leading to heart muscle fatigue that manifests as whole body exhaustion. As blocked arteries restrict blood flow to your heart muscle, your heart's overall efficiency decreases. Your heart compensates by beating faster and working more vigorously, but this increased workload ultimately exhausts your heart muscle. This cardiac fatigue then translates into systemic fatigue, impacting your entire body. Women are more likely to experience fatigue and sweating as primary heart disease symptoms rather than the classic chest pain. Many women have reported sudden, inexplicable exhaustion for days or even weeks before experiencing a heart attack. Next, number five, pain that spreads beyond the chest. Pain extending beyond your chest creates a complex network of discomfort that can easily confuse both patients and healthcare providers. When your heart muscle doesn't receive adequate blood flow due to blocked coronary arteries, the resulting pain doesn't respect conventional boundaries. The heart shares intricate nerve pathways with multiple areas of the upper body, causing cardiac pain to manifest in the shoulders, arms, either or both, though often the left, back, neck, jaw, teeth, or even the upper abdomen. Research from the Mayo Clinic extensively documents this diffuse pain pattern. Left arm pain is particularly strongly associated with cardiac events, but discomfort can indeed affect either or both arms, often described as an aching, heaviness, or pressure rather than a sharp, localized pain. Back pain, especially between the shoulder blades, is frequently reported but often dismissed as mere muscle strain. Jaw and neck pain present significant diagnostic challenges because they are often attributed to dental problems or neck tension. However, when jaw pain occurs alongside other cardiovascular symptoms, or when it appears specifically during exertion and subsides with rest, it strongly suggests a cardiac origin. The pain may feel akin to a toothache, but its pattern reveals its true cardiac nature. Upper abdominal pain is perhaps the most misleading symptom, frequently mistaken for indigestion when it should, in fact, prompt immediate emergency medical care. The inherent danger lies in people seeking inappropriate treatments, visiting dentists for jaw pain, or trying antacids for abdominal discomfort, while underlying arterial blockages continue to gravely threaten their cardiovascular system. Next, number six, leg pain or cramping while walking. Leg pain or cramping that consistently occurs while walking and reliably subsides with rest is a hallmark symptom of peripheral artery disease, PAD, a condition where the arteries supplying your legs become blocked. This symptom typically manifests as cramping, aching, or a sensation of fatigue in the leg muscles during activity, most commonly affecting the calves, but potentially extending to the thighs, hips, or buttocks. Research in vascular medicine clearly shows that peripheral artery disease rarely occurs in isolation. Experts at the Cleveland Clinic note that PAD affects over 200 million people worldwide and approximately 12 million adults aged 40 or older in the United States. If you have blocked arteries in your legs, there is a very high probability of arterial blockages in other critical areas of your body, including your heart and brain. This makes intermittent claudication, the medical term for this type of leg pain, a whole body warning sign that your arterial system is compromised. The underlying mechanism is concerning. When leg arteries become narrowed by plaque, they can provide adequate blood flow at rest, but simply cannot meet the increased demand during physical activity. This discrepancy leads to muscle cramping as the tissues experience oxygen deprivation. The pain is predictably consistent, occurring after similar walking distances and reliably improving with rest. Many people unfortunately dismiss leg cramping as normal aging, poor fitness, or muscle strain. However, true intermittent claudication possesses distinct characteristics that differentiate it from other causes of leg pain. The progression is particularly alarming. It may initially be noticed during longer walks, then begin to occur with shorter distances, eventually severely limiting normal daily activities as the arterial blockages worsen. Next, number seven, non-healing foot or leg sores, persistent coldness, or significant color changes. Visible alterations in your feet and legs are crucial indicators of severely compromised blood flow. These include non healing sores or ulcers, persistent coldness, and distinct skin color changes. These symptoms represent advanced stages of peripheral artery disease, signaling that arterial blockages have reached dangerous levels. When the arteries supplying your extremities become severely blocked, the tissues simply do not receive adequate blood flow to maintain normal healing processes and temperature regulation. Non healing ulcers or sores persist for weeks or even months because the blocked arteries cannot deliver sufficient oxygen and nutrients essential for healing. Cleveland Clinic research documents that persistent coldness in the feet or legs, especially when one limb is noticeably colder than the other, strongly indicates significant arterial blockages. Your extremities should maintain a consistent temperature through adequate blood flow. When this is compromised, your feet and legs will feel persistently cold, even in warm environments. Color changes provide clear, visible evidence of compromised circulation. The skin may appear pale, bluish, or abnormally shiny due to reduced blood flow, sometimes presenting with mottled patches that indicate uneven blood distribution. Hair loss on the legs and feet represents another important circulation indicator. Hair follicles require adequate blood flow for normal growth, and reduced circulation causes hair growth to slow or stop entirely. The temperature difference between limbs can be particularly telling. If one leg or foot feels noticeably colder than the other, this strongly suggests a significant arterial blockage affecting that specific limb, indicating substantially compromised blood flow compared to the unaffected side. Next, number 8, erectile dysfunction in men. Erectile dysfunction, ED, frequently serves as an early warning system for arterial blockages throughout the entire body, often appearing years before more overt cardiovascular symptoms manifest. Erectile function is entirely dependent on adequate blood flow to specialized penile blood vessels. Research from the Physicians Committee for Responsible Medicine firmly establishes a strong connection between erectile dysfunction and cardiovascular disease. The arteries supplying the penis are considerably smaller than those serving the heart and brain, meaning they often become blocked by plaque before larger arteries show significant narrowing. Men who develop erectile dysfunction, particularly without any obvious psychological causes, have significantly higher rates of subsequent heart attack, stroke, and peripheral artery disease in the years following its onset. Atherosclerosis, arterial hardening, does not discriminate by location. If plaque is accumulating in penile arteries, it is highly probable that it is also accumulating throughout the rest of the body, including the arteries of the heart and brain. What makes this connection invaluable for early detection is its timing. Erectile dysfunction often appears years before other cardiovascular symptoms become noticeable, providing men with a potential crucial window to address underlying arterial disease before it progresses to more dangerous stages. Many men mistakenly attribute erectile dysfunction to stress, aging, or psychological factors. While these can certainly play a role, the vascular component should never be ignored. When ED occurs without clear psychological triggers, especially in men over 40, it absolutely warrants a comprehensive cardiovascular evaluation. This symptom powerfully demonstrates how intricately interconnected your circulatory system is. Problems in one area frequently reflect problems throughout your entire arterial network. Next, number 9, transient ischemic attack, TIA, or stroke like symptoms. Transient ischemic attacks, often referred to as TIAs or mini strokes, indicate that brain arteries are blocked or severely narrowed, creating temporary interruptions in blood flow that produce acute neurological symptoms. A TIA essentially starts like a full blown stroke, producing similar stroke like symptoms such as sudden numbness or weakness, often affecting one side of your face, arm, or leg. Other unmistakable symptoms include facial drooping, which creates an asymmetrical appearance, speech difficulties characterized by slurred or garbled words despite clear thinking, difficulty understanding others' speech, and various vision problems, including sudden vision loss, double vision, or visual field cuts. However, a TIA differs from a full stroke in that its symptoms resolve completely within a few minutes or up to 24 hours, leaving no residual effects. Research from UT Southwestern Medical Center emphatically emphasizes that these symptoms, even if they resolve completely within hours, represent medical emergencies. Approximately one-third of people who experience a TIA will subsequently have a more severe permanent stroke. The temporary nature of these episodes often deceives people into thinking they weren't serious, but TIAs are a stark warning that brain arteries are severely compromised and a major stroke could occur at any time. The carotid arteries, which supply blood to the brain and are located in the neck, are common sites for blockages that cause these symptoms. These large neck arteries can develop significant plaque buildup that either directly blocks blood flow or releases small clots that travel to smaller arteries within the brain. Speech difficulties occur because the brain areas responsible for language processing are not receiving adequate blood flow. Vision problems can be particularly frightening, with portions of the visual field simply disappearing, much like having a curtain drawn across part of your vision. These symptoms demand immediate medical attention, regardless of whether they resolve on their own. Finally, number 10, the 6 Ps of acute limb ischemia. The most severe and urgent arterial blockage warning sign is acute limb ischemia. This critical medical emergency is often remembered by the mnemonic of the 6 Ps: pain, pallor, pulselessness, paresthesias, paralysis, and poikilothermia, or polar perishing cold. Acute limb ischemia occurs when an artery supplying an arm or leg becomes suddenly and completely blocked, representing a true medical emergency demanding immediate intervention. The pain is typically severe and sudden in onset, constant, and does not improve with rest. It often feels like a deep burning sensation within the affected limb, progressively worsening as tissues become starved of oxygen. Pallor refers to a markedly pale appearance. The limb loses its normal coloration and appears pale, white, or waxy when compared to the unaffected limb. Pulselessness means that normal pulses cannot be felt below the level of the blockage. Healthcare providers specifically check for pulses at various arterial points, and in acute limb ischemia, these pulses are absent. Paresthesias involve abnormal sensations such as tingling, numbness, or pins and needles, which occur as nerve tissues become oxygen deprived and begin to malfunction. Paralysis represents the loss of motor function as muscles and nerves become increasingly oxygen deprived, often beginning with weakness and progressing to a complete inability to move fingers, toes, or the entire limb. Poikilothermia refers to the limb becoming distinctly cool or even cold to the touch due to inadequate blood flow to maintain its normal temperature. These symptoms signify a critical race against time. Tissues can only survive for limited periods without blood flow before irreversible damage occurs, potentially leading to the need for amputation. The presence of multiple Ps indicates an immediate surgical emergency where every hour or even minute can determine whether a limb can be saved. These 10 vital warning signs collectively represent your body's sophisticated alarm system, desperately attempting to alert you to arterial blockages that could imminently threaten your life. From the subtle pressure of angina to the acute medical emergency of acute limb ischemia, each symptom provides crucial, actionable information about the state of your cardiovascular system. The profound tragedy is that most people unfortunately ignore these warning signs until it's critically too late. Recognition and swift, decisive action are absolutely paramount to survival. It's important to understand that these symptoms do not occur in isolation. They often represent a broader spectrum of arterial disease affecting multiple parts of your body simultaneously. If you recognize any of these warning signs, and especially if multiple signs are occurring together, you must seek immediate medical evaluation. When it comes to arterial disease, time is quite literally life. Remember that arterial blockages develop gradually over many years, much like rust slowly accumulating in pipes. However, their consequences can appear suddenly and dramatically. The chest discomfort you might dismiss as mere stress, the leg cramping you attribute to simply getting older, or the breathlessness you blame on being out of shape could all be early warning signs of life-threatening arterial disease. These symptoms are your body's urgent plea for you to pay attention before it's too late. Your cardiovascular system is an intricately interconnected network. Blockages in one area often indicate widespread problems throughout your entire arterial network. This means that peripheral artery disease in your legs could be signaling hidden coronary artery disease threatening your heart, or erectile dysfunction could be a critical warning of an impending stroke risk. Individuals who recognize these symptoms early and promptly seek appropriate medical care have significantly better outcomes and prognoses than those who ignore the warning signs until major cardiovascular events occur. The research is crystal clear. Early detection and timely intervention can prevent heart attacks, strokes, and other potentially fatal cardiovascular emergencies. Your life may quite literally depend on your ability to recognize these symptoms and take them with the utmost seriousness. Do not become another tragic statistic. Act decisively on these crucial warning signs. If this video was helpful in any way, please be so kind as to type helpful in the comments section. That truly motivates us to continue producing more content like this. Please also like this video if it provided valuable information. Share it widely with friends and family who need to be aware of these critical warning signs, and subscribe to our channel for more life-saving health information. Thank you for watching, and thank you for taking your health seriously enough to learn these potentially life-saving warning signs.